Welcome to the deep dive. You know, it's a common assumption, isn't it? New tech, especially in medicine, you automatically think better. We picture these modern marvels, like a surgeon with a laser, zapping away problems. Futuristic precision?
Right. It just seems inherently superior.
Exactly. But what if, maybe, that assumption doesn't always hold up? Today, we're peeling back the layers on some, well, really surprising analysis that challenges that very idea. We're doing a deep dive focused on a position paper by Dr. Lev Neymotin. It's called The Case for Scalpel Over Laser in Surgery.
Provocative title.
It is. And his argument, basically, that the laser, for all its high-tech appeal, might actually fall short of the humble scalpel in some really crucial ways.
Like what specifically?
Well, he talks about hidden tissue damage, maybe less precise control than you'd think, potentially longer recovery times, and even a huge cost burden that kind of impacts all of us.
Wow.
Yeah. So it's not just about the tools, it's about what real progress looks like in the operating room. Okay, let's unpack this.
Yeah, I mean, what's fascinating here is how Dr. Neymotin really cuts against the grain of, popular perception. In an age where high tech usually means high value, he's asking us to stop and think. How can a traditional scalpel, a tool that's centuries old, still hold its own? Or even be better sometimes.
Right.
Makes you wonder, doesn't it? What are the hidden costs, the complications with lasers that maybe we don't talk about enough? That's the core intrigue, I think.
So we're looking beyond just the procedure itself. We need to look at the bigger picture. We're going to break down Dr. Neymotin's key concerns, sort of step by step. We'll get into the biophysics, how these things actually interact with tissue, all the way through to the economics, and even, the patient experience. It's a really comprehensive look at why sometimes newer isn't automatically better. Okay, so let's start with Dr. Neymotin's opening shot, right? His main argument. He states pretty clearly that lasers, despite this reputation for precision, encounter underappreciated issues. Collateral damage, cost burdens, procedural inefficiencies.
That's a strong claim.
It is. Especially when we've all kind of been conditioned to see laser surgery as the gold standard,
Absolutely. And that's why this perspective is so significant. It forces us, really, to question this sort of uncritical adoption of new tech. Dr. Neymotin's point isn't about, rejecting innovation. It's about making sure we always choose the safest, the most effective, and crucially, the most sustainable option for the patient.
Sustainable, that's interesting.
Yeah, and he focuses particularly on ophthalmology eye surgery. That's an area where both scalpels and lasers are widely used, so it makes for a really good comparison.
Okay, so if he's challenging such a deeply held belief, where does he start? How does he begin to dismantle this idea? Does he go straight to clinical trials?
He actually takes us right back to basics, to how these tools physically interact with our tissue, because, as he argues, that fundamental difference is where it all begins.
Right. Makes sense. Okay, so let's dive into that. How do lasers and scalpels actually cut tissue? What's the difference?
Okay, let's start with laser tech. Laser light.
Okay.
It's not a solid blade, obviously. It's made of highly focused photons. Think of them less like a cutting edge and more like incredibly fast, discrete bullets of energy hitting the tissue.
Yeah.
So the laser cuts by concentrating this energy into a tiny spot. This causes instantaneous heating. Then you get something called plasma formation. And then microexplosions.
Microexplosions!
Well, yeah, tiny ones. The process is called pulsed photodisruption. These rapidly expanding plasma bubbles are actually what split the tissue apart, rather than a clean slice.
Huh.
Now, here's the critical part Dr. Neymotin highlights. This high energy delivery, it can lead to localized heating right at the tissue edges. He vividly describes it as frying the tissue.
Oof, not a great image.
No. And this thermal stress, even if it's subtle, can actually impair immediate post-op healing. It's an unintended side effect baked into the laser's mechanism.
And when you contrast that with the scalpel, wow, it's completely different, isn't it?
Totally different.
We're talking microsurgical blades, usually steel or maybe diamond, right? And they separate tissue just by, mechanical slicing. Simple.
Exactly.
And here's where it gets really interesting, I think. With a scalpel, zero thermal effect, none of that frying.
Right.
The surgeon keeps full tactile control. They can feel the pressure, the depth of the cut.
That feedback is key.
It results in incredibly clean edges, no heat damage. Tissue is just parted, not, exploded or burned, which means less work for the body to heal.
And that tactile feedback you mentioned, it's absolutely crucial. It lets the surgeon feel the tissue resistance, adjust their force, their direction in real time, millisecond by millisecond.
Which brings us naturally to precision. Because that's the common belief, isn't it? Laser equals precision. A computer-guided laser must be more precise than a human hand.
That is the popular idea.
Mm.
But Dr. Neymotin offers a counter-argument that honestly really makes you pause. He argues lasers aren't necessarily more precise in every single situation because they work through that volume-based disruption, those microexplosions.
Right.
They can actually penetrate deeper into the tissue than intended.
Oh, okay. How?
Well, think about it. A tiny optical misalignment when focusing the beam, or maybe a little wrinkle in the tissue, or even just the patient moving slightly,
Yeah.
any of that can shift the focal point deeper. And here's the critical factor. With a laser, you lose all tactile feedback completely. The surgeon relies only on what they can see. This increases the risk of unintended damage, especially when you're working with really thin or sensitive structures where feeling the tissue gives you vital information.
So it's like trying to navigate a complex maze blindfolded just using a map versus actually walking through it and feeling the walls.
That's a great analogy, exactly.
So true precision. It sounds like it's more than just a narrow beam. It's about control, feedback, adapting on the fly. That's a really surprising nuance.
It is. And beyond just the immediate cut, Dr. Neymotin also digs into the postoperative recovery side of things. When we look at laser surgery, some studies suggest wound healing can be, well, slightly delayed.
Why is that?
It's attributed back to that thermal and mechanical stress from the laser pulses. Reports mention things like micro-irregularities at the incision site, maybe some edema that's swelling, usually transient, but still, it's there.
Okay.
Contrast that with scalpel surgery. Healing is generally faster, cleaner. The tissue repair just proceeds more naturally because it doesn't have that extra burden of dealing with thermal injury. It's just a smoother path back to normal.
Okay, speaking of burdens, Dr. Neymotin doesn't pull any punches on the economic side, does he? This isn't just about clinical outcomes.
Not at all.
He brings up the elephant in the operating room, the cost.
Exactly. Yeah, he breaks it down. First, the local cost impact. Laser surgical equipment. It's incredibly expensive to buy it, to maintain it, to operate it.
Right, I can imagine.
Plus, the setup time for laser procedures is often longer, and the procedures themselves can take more time. That translates directly into more surgeon time, more facility time. It all adds up.
More billable hours.
And then there's the bigger picture. Yes, the systemic cost impact. Think about this across thousands, maybe millions of surgeries. These increased costs put huge pressure on the whole insurance system. Medicare, Medicaid, private insurers, everyone. And when so much money gets funneled into these high-cost laser procedures, potentially for routine cases, well, those funds might be diverted from other healthcare areas that could maybe offer a better return on investment for public health overall.
Wow. That forces you to ask, are we really getting the best medical value for our healthcare dollars with this tech in every single case?
That's exactly the question he raises.
It's a powerful point. Really makes you think about the ripple effects. What stands out to you most about these sort of hidden costs? And think about the patient again. How does all this actually impact their experience beyond just the technical stuff?
Well, it connects directly. As Dr. Neymotin points out, laser procedures often take longer to prepare, longer to actually complete.
So more time hanging around, basically.
Pretty much. More time in pre-op, maybe more time under sedation or anesthesia, just a longer overall day. And then those slightly longer healing times we mentioned, that can mean more discomfort for the patient afterwards, potentially more follow-up visits, and just a longer wait until they're fully recovered and back to their normal life.
Okay, to really make this concrete, Dr. Neymotin uses a great real-world example, cataract surgery. Super common procedure.
And one of the most common globally, yeah. So it's perfect for comparing these approaches.
All right, so let's break down the pros and cons he presents. First, the traditional microsurgical blade steel or diamond.
Okay, pros for the blade. You get cold cutting, no thermal effect, excellent healing profile, backed up by decades of clinical history, really low complication rates. It's very cost effective.
Good for the system, good for the patient's wallet, potentially.
Right. And as we've stressed, it's surgeon controlled. Direct tactile feedback, lots of flexibility.
Okay, what about the downsides, the cons?
The cons. There can be slight variability in how the incision is shaped, just because it depends on the surgeon's hand. It's maybe less perfectly reproducible than a programmed laser, and yet it relies more heavily on the surgeon's individual skill and steadiness.
Okay, now flip side. Femtosecond laser-assisted cataract surgery or FLACS. The high-tech option. pros?
Pros are definitely there. High precision and repeatability. It's computer controlled down to sub-millimeter accuracy. It can create really ideal incision shapes, especially these multiplanar self-sealing ones.
Which can be good for healing too, presumably.
Potentially, yes. And it often combines steps like making the initial opening in the lens capsule and breaking up the lens itself. This can sometimes reduce the amount of ultrasound energy needed later in the procedure.
Okay. Less energy, maybe less stress on the eye. Sounds good. What are the cons?
Cons are significant. First, much higher cost the machine, the procedure fee.
Yeah.
There's still some risk of thermal damage, though it's generally minimized. It takes longer to set up calibrating the machine, getting the imaging right, surgeon adapting.
Right.
And there's still that potential we talked about for the laser energy to impact tissue deeper than intended if the focus isn't perfect or something moves.
Dr. Neymotin also digs into some specific clinical worries about lasers, right? Beyond just the general stuff, things like edge damage and that deeper penetration risk.
He does. Regarding edge damage, that localized heat and the microcavitation from the laser pulses, they can cause some collateral tissue damage, especially if the energy level is high or the tissue isn't optimally hydrated.
Is that usually serious?
Typically, no, not in the long run,
Yeah.
because you can get transient edema, that swelling, or some irregularities that might affect how quickly the patient's vision clears up right after surgery.
Okay. And the deeper penetration.
Yeah, that's a more serious concern.
Yeah.
Even though these lasers are precisely calibrated, things can happen intraoperatively, tiny movements, targeting inaccuracies that shift the focal point deeper.
And the risks there are.
Potentially quite serious.
Well.
Tearing the posterior capsule, which is the back membrane of the lens, macular edema, swelling in the retina affecting central vision, or stressing the zonules, the little fibers holding the lens. These are complications you really want to avoid.
Now, to be fair, there are technologies to help manage these risks, aren't there? Like advanced imaging, OCT guidance, ways to modulate the laser energy.
Absolutely. Those mitigating technologies exist, and they are improving. OCT-guided targeting, better energy control systems, they definitely help. But as Dr. Neymotin would argue, these are additional layers of complexity. And of course, additional costs pile onto an already expensive technology.
Right. Which kind of brings us back to the core questions. Okay, so when you weigh everything, precision, damage, healing, cost, control, safety, what's the final verdict according to Dr. Neymotin? Where do they stand?
He lays it out pretty clearly. For precision, blade is good, but depends on the surgeon. Laser is excellent, computer-guided. For tissue damage, blade is minimal, cold cut. Laser is low risk, but possible thermomechanical effects. Healing, generally faster with the blade. Laser is comparable, but potential for slight delays. Cost, blade is lower. Laser is significantly higher. Customization, manual with the blade, programmed with the laser. And overall safety, both are very safe, but the laser adds that layer of technology dependence.
So boiling that down, what are the best use cases for each? Based on his analysis, when should you reach for the scalpel versus the laser?
He suggests blade-based surgery is probably preferable when the priorities are safety, keeping costs down, and absolutely minimizing tissue trauma, maybe for more routine cases.
Makes sense.
Laser-assisted procedures, on the other hand, are ideal when you need extreme reproducibility, or for more complex cases like correcting significant astigmatism during the cataract surgery or dealing with a particularly dense cataract that needs more fragmentation. So ultimately, Dr. Neymotin's final thought is really quite powerful. Laser surgery. It's a tool. A sophisticated tool, yes, but not a miracle cure-all. It's not automatically better than a scalpel. That perceived precision has to be weighed against the real risks, tissue damage, the huge cost, the loss of that crucial surgeon control and tactile feedback. Medically, lasers bring in new factors like heat damage, machine reliance, no feel for the tissue. These can affect healing and add risks, especially if used without careful consideration. Whereas scalpels, in skilled hands, reliably give clean cuts, minimal trauma. Economically, widespread laser use, sometimes without clear added benefit in simple cases, eats up resources, equipment, time, insurance money. He argues this leads to inefficiency in the system.
So it's about appropriate use.
Exactly. For routine, high-volume stuff like standard cataract removal, he argues the scalpel is still incredibly effective. Minimal trauma, faster recovery, lower cost. Lasers definitely have their place in complex situations, but shouldn't just replace proven methods across the board.
So what does this all mean for us, the listeners? I guess it means that clinical decisions really need to be grounded in the specific patient's needs, how complex the surgery actually is, and thinking about healthcare sustainability overall, not just getting swept up in the excitement of the newest, shiniest technology.
Wow. What a fascinating deep dive this has been, seriously.
Yeah.
I think the most striking thing for me is just the surprising relevance, the staying power of a traditional tool like the scalpel,
Yeah.
especially when it's in the hands of a skilled surgeon,
Yeah.
even in this super high-tech era.
Yeah.
It really forces you to reconsider what progress actually means sometimes.
It absolutely does. It's a powerful reminder, isn't it? Sometimes the simplest solution, the most controlled one, is still the most effective and the most sustainable overall. Innovation is vital, but it needs to be genuinely additive, not just substitution for its own sake. Which leaves us with a pretty provocative thought to chew on, I think. As technology keeps accelerating, how do we make sure that innovation truly serves patient needs and the sustainability of the whole healthcare system? How do we avoid just chasing novelty?
That's the million-dollar question.
And maybe, what other areas of medicine or even other fields might benefit from this kind of deep dive reevaluation? Where might established traditional practices still hold their own against the latest and greatest? Something to think about.